Ways and Means to order.
I'll call the Human Resources to order. The first item on the agenda for Human Resources is approve the annual report of social services.
So moved.
Is there a second? Mr. Shaw. Is there any discussion? All those in favor? Aye. Opposed? Carried. Is there any other for Human Resources?
Mr. Chairman.
Yes.
The conversations in terms of what's going on with Country Manor has, various people in the community talking, asking questions. I certainly have questions on it. And I know that we've been waiting. Apparently, we've had 2 firms express an interest in Country Manor, and I think I was corrected at the last meeting that there may be a 3rd, but we haven't gotten anything. Can we have an update on what the status of that is, please?
Yeah, we have 3 companies very interested. A 4th one called today. We had the appraisal. You guys authorized the appraisal. That was done. We have that information now. That, as everybody knows, we cannot give a gift. So that information has been shared.
What was that thing you said, Jim, about the gift?
It can't be a gift. That's from our attorney, that it can't be a gift. So we're working through those issues. And we're hoping to come back to these 2 committees within the month.
Is there anyone negotiating or having conversation with any of the people that have sent in plans to decide to lean out what's a good plan?
I would say more clarification, and it's been myself and Rob. It hasn't been the legislature.
Mr. Chairman, I wonder if now it's grown to 4, maybe there's some other people out there, and I know when I asked this before, and Mr. Bono's comment was, when will it stop? But I just wonder whether it wouldn't be wise to put together an RFP on this. There could be lots of people out there, or nobody. All the 4 proposals, or the 3, and the 4th one that might be forthcoming, to really clarify what it is that we're looking for, and then give people within that RFP the opportunity to even step outside of it for further consideration. But some advertisement. The fact that there's 3 or 4 that might be interested really isn't getting much play in the papers, in the media, so if there's a 5th or a 6th, they don't know about it necessarily. And I know I have had a concern, where will our people go, where will the future need go? And I heard the other day, I don't know whether this is true or not, but that the Valley Health is talking about maybe building up at the college. And I don't know whether it's true or not, but that certainly would help mitigate the need we would have in our community if we understood all of that too. And I don't know if the Human Resource Committee is looking at where will people go, how will we deal with them, and just to show the citizens that we're looking at the various angles, to be certain that...
I was quoted in the paper, I think, saying that the legislature, you got to have 9 votes to do anything. I mean, we've been trying to sell the place for 12, 14 years. Was that the fact that we wanted the 31 individuals that were there taken care of. And that's part of the discussion that's happened at my level, not at any committee level. And also the issue with the gift. Those are probably the two biggest issues we've been talking about.
And Valley Health came in and gave a little presentation in regards to what they were doing. It was very brief, but
How long ago? I must have...
you probably weren't here. It was just within the 2 months, maybe.
And Jim, I do appreciate that we're concerned about the 31. There were other people that were here to go in and we can't handle them because we've kept that census down because of staffing issues or whatever. So knowing that there's other potential places within the county certainly would ease some of the concerns that I have. And I just wonder about the RFP part of this process. When you say we can't gift it, the plan that we had with Valley Health, that when they pulled out before, they were going to take the site. That must not have been cleared then. At that point, we thought we could do it then and find out now we can't?
Well, you're still working through a lot of issues.
I have to make a clarification. It wasn't Valley Health, it was the college that they came in to talk to us about.
Oh, I listened to that, yeah. The potential of marketing property for something that's compatible to their... Okay. I guess I'm curious if this committee would consider doing an RFP, and let's really find out just what's out there to do. And if there's nobody, then it's the four that, or three that have voiced an interest.
You gotta be very careful about doing that too.
Why?
There's a big chance that the four people that we got interested in it might walk away from this. Then we will just,
Or sue you because it.
Why would they walk
They
away?
would
if
walk
they're
away
interested?
because we got an RFP,
I'm
and they
just
may
telling
not
you,
be
I'm
worth
telling you.
talking.
People need to be acknowledged by the chairman,
Everybody.
instead of screaming at each other.
Exactly.
You've done an RFP at one point, didn't we?
Six-
We've done it twice, Bob.
Twice.
We haven't done it since 2006 or 7, was it? And some of these firms weren't on the horizon back then. I just wonder where we're showing, if there's any potential out there, I don't know. Okay. Is it an RFP, could we put something in that says Herkimer County is accepting proposals? And let everybody out there, I mean, just something that you know that you've
Is it, Mr. Chairman?
attempted to get it from the market.
yes.
I don't know how it would be fair if the information's been out there. How could you RFP it? You know, it's not fair to the three that's already bid it.
But you didn't ask them, they didn't bid it, Mr. Bono, because we didn't ask them to do it. They just unsolicited.
Irregardless, there are proposals out there. I mean, they're not gonna change the proposal now that we
They
RFP
might if they
it.
know there's competition.
I mean, they might.
I mean, is it fair to anybody else that these four happen to stumble upon this thing? I mean,
We put it out
It
there
was out
twice.
there.
We put it out there
No, it
twice.
wasn't out there. It
Yeah,
came in as a secret at a executive session, the initial request.
No.
Excuse me.
Mr. Chairman, I just want to emphasize, you
Wait a
know,
minute, wait a minute. The initial request was from Valley Health.
I'm talking
I mean-
since Valley Health pulled the plug.
Yeah. And these other ones could do the same thing. You know, I mean, I don't want to chase anybody away if they're willing to purchase this. You can't keep on taking people's bids and then go out for other bids. You know what I mean?
We didn't take bids though, that's the problem I'm
Yeah,
having
but
with it. It wasn't a
the
bid.
people that are willing to come in now and bid already have knowledge of what the other ones have bid.
Do we know for a fact that we're allowed to do this without going out in the marketplace, transfer this program? Has our county attorney ruled that this is okay, the process that we're following? I guess I want to be comfortable with that. The county attorney said that we can take in any proposals that come without soliciting them, consider it, and be able to go forward without it being a formal RFP?
As long as it's not a gift.
As long as we're not giving the property, we're free to take any, without going out in a formal
The
process, it's okay.
complicating factor is we're trying to maintain the 31 individuals. That's a very complicating factor.
I appreciate it,
That changes the whole,
but we're on solid fiscal ground.
Rob Malone is with me every step of the way.
Right,
And I'm not gonna speak for Rob Malone.
Mr. Chairman?
Yes.
I mean, we're talking about there has been bids and whatever.
Well-
Has there been any formal procedure for accepting these bids by any entity within this legislature? Or is it just getting, somebody might see Mr. Bono, somebody might see Mr. Smith, and somehow it makes its way to Mr. Wallace, Mr. Malone? I mean, we're worried about them not being fairly bidders, and there has been no formal procedure, at least that I'm in the loop on. Or has there been?
Everything was addressed to either Mr. Wallace or Mr. Malone. It didn't come through me, it didn't come through Mr. Smith. These things just, they show up on the desk. We're interested. A letter is written, Mr. Wallace responds.
I don't know, during the course of the conversations I've heard, I can't remember individual legislators saying, I've been approached by this possibly third entity.
Not this
or
guy.
whatever.
Mr. Chairman, I just want to emphasize that my main concern is yes, it's not a viable situation for the county to be in. That's definite, okay? Obviously, we let that go for 10 years now, we want to get rid of it, so, and the story there. My main concern is the employees and the people that are there, the residents. We worry about our jail spending $35 million. I know it's a bad subject for everybody. You know what? Those old people are more valuable. They've already served their time. They've already paid their dues to society. I just wanna make sure that they're taken care of, as well as we're worried about taking care of these inmates.
You gotta remember, there's only 2 or 3 counties in the state.
Exactly.
You're asking the poorest county in the state to maintain it.
Oh, no, I'm not saying
No,
maintain it.
what I'm saying, Bob, is everybody else has stopped doing this.
Oh,
They
yeah.
cannot do it.
But what I'm
Cannot
saying,
do
though,
it.
is-
Medicaid is taken over, we can't do it. We're building a jail to try to save $600,000 or $700,000 a year.
Right.
That's why we're pushing forward on the jail.
Right.
Because we keep pissing money out the window.
Exactly.
What we're trying to do is save some other programs by spending the money on the jail, so that we have $600,000 or $700,000 to spend on some of the other programs, so we're not in the same position as we are with the Country Manor, and that we are with CHA, and that we were with hospice, because the state is kicking our butt every stinking day. I just said it a few minutes ago, overburden aid, that we were very successful, one of 6 or 7 counties in the state that kicked the crap out of the state on that. What they do, they put a thing in the governor's budget, gone. So the 6 or 8, 7 of us got skunked.
Well, I'm
We
not.
lost $500,000.
Jim, I'm not disputing, that's what I said, it isn't a good situation for the county to be in. It's what I'm saying.
We're
is-
mandated to do certain things.
Right.
People in this county, if you look at the stats of the people in the county, there's
Right.
nobody left. In
Exactly.
1950, we had 7,300 kids, 0 to 5. Today, we've got 3,200 kids. Somebody take a look at what the heck is going on around here. Let's start thinking, using our heads, cut the crap, and try to do what's good for the county, good for the taxpayers.
Cut the crap that we're asking for a procedure and due deliberation. That's crap.
Gary, we've been after it 12 years. We've been after it 12 stinking years. Everybody in the state knows what's going on with this. If you're in the business, you know what's going on. You don't think Citron and all those other places know? Gary, quit smirking at me. Answer me.
I'm here, I'm elected representative. I'm
Absolutely.
not gonna argue with you.
Why not? Come with some
I'm
guts and come with
not.
some
Why
conviction.
not?
Let's fight for it. Let's get something done.
I am. I'm asking for RFP so we get the best deal possible. And our people are taken care of, both the
That's
residents.
impossible.
We already said that.
We're losing $550,000, $600,000 a year.
So
What's the best
there's
deal
the way to
possible?
do it, and any other public body would not be 2 or 3 individuals happen to be getting.
We did, Gary, you didn't hear us, we've done it twice, Gary, you're not listening, we've done it twice, when does it end?
And I know, I'm not saying asking Mr. Chairman to argue, I just want to just make one point, and Jim, I agree with you. We have to do it, it's not happening anyplace else in the county. If you forget it was Country Manor, and you think about, I wanted to provide a service of, oh my gosh, let me give an example. Providing whatever service in the Department of Social Services for the kids program. If I came into you and said, this is the service I would like to render for you, here's my proposal. You didn't solicit it. Here's my proposal. I want to render this service. And 3 other companies come in and said, I want to render this service. We could not just take those 4 and consider it. What I don't want to see happen is, as we're seriously considering these, we're not given bum legal advice and find out it was all for naught. We were down the road with Valley Health, and Valley Health pulled the plug. But we were of the impression, at least I was, that we were going to be able, in a particular calendar of events, to be able to transfer that property, the building and everything, to Valley Health. That's what we were told in that whole agreement. Now we found out now, new information, new law, no. Existing law, we can't do that. I want to be certain that as we're dealing with these 3 or 4 or 2 or 6, that we are on sound fiscal, public officers law, whatever the hell the laws are that guide this, that we don't find out, you know what, because there's going to be a court challenge by unions or families or whatever it might be, that we are truly okay with taking unsolicited by us proposals that we're going to weed out to come up with the one that we want. That's the concern I have on this. And I just wonder if the legal advice changed from Valley Health, will it change again when we find ourselves in the pickle? Or are we so certain that our county attorney's office has got this right this time?
You're never going to be so certain, Helen. I said
Well,
that.
we're paying good money.
Well, I said that, but you know, you end up in court all the time. And when you're talking
Well,
about.
we lost some good ones.
It's not, we haven't lost too many. Ask the village of Herkimer how we come. My point is, when you're talking about our priority, and what I've heard, unless that's changed, is the fact that we're trying to take care of those 31 individuals. That does change, it's
But
not
does
a
it change the
perfect,
law?
it's not a perfect system.
But does it change
Because
the
we're
law
not-
and our ability to independently negotiate?
I
That's
think
what
if
I'm
you
saying.
talk to 3 or 4 attorneys, they'd give you 3 or 4 different answers.
Just one more brief comment. I think Valley Health, I may not have been here 14 years for this, as long as you've been trying to sell it in whatever which way. I think Valley Health is Exhibit A. I live in Herkimer, I was on the board, we had a business that all of a sudden, I had people calling me left and right, and I even talked to legislators. Most of the legislators, as far as I know, weren't even aware of what was going on until there was something that hit the paper that somebody received the grant, and how did that happen, and who authorized the grant application and all this. That's Exhibit A for why we should be more transparent. And,
No idea what you're talking about.
I don't know.
well, I'm telling you,
What did that mean? I don't understand. Just please clarify.
the public and officials that I talked to that day were unaware of what was going on until it hit the papers.
With what, in regard to what?
Your Valley Health deal that fell apart.
That was a Valley Health.
That was,
That was
okay, whatever, but it was part of the negotiations that,
That was a
I
grant
don't
they
think,
got.
All right, we've got a lot to do, so I know it's Human Resources Committee, but we
Can we
gotta,
just have a copy of the RFP that we're claiming that we did, the latest one we did? Can someone find that and just share a copy of that? I'd appreciate it. Thank you.
as far as the Ways and Means Committee, when all those 3 or 4 proposals get together, we'll bring it to committee, probably have a dual committee, I would assume, and talk about it, but until we know what's going on, we aren't gonna do that.
Are we still accepting admissions?
No. At least,
When we asked him,
32.
Yes. Up to 32.
how many other presidents?
that was our direction, Mr.
I
Mayor.
understand.
31.
I think it's
Okay.
suicidal to continue to receive admissions.
The last few days, Tim came to me, asked me, and I said, absolutely, you have the authority to go up to 32.
Tim, I think it would be a wise choice to make sure,
Stop.
oh, sorry about that, Mr. Chairman. Mr. Chairman. Can I, Tim, I think it would be a wise choice. I mean, if you're elderly, okay, my mom was up there, okay? Those people are in the midst of the fire, all right? Line of fire, shall I say. I just think that somebody should go up there and acknowledge that, let them know that we are working for their best interests. I mean, we're all gonna be there one day, we're gonna be old. And you gotta pay the respect to the people that are there. Because one day you might be that person, and you wouldn't like it if somebody came in and pulled the rug out of you. I think you're gonna make a better transition, however it turns out, if you be upfront with the people that are there.
We've done that.
Okay, I mean, all right, I'm just,
Been there.
There's
Okay.
a lot of best interests.
I want the best for the people that are there. I'm asking, are we still accepting more people as vacancies occur?
one, you said up to 32. You said 31, didn't know that.
But what I'm saying is, if we just said no more admissions, period,
That's what I thought.
I think that's what we should be doing.
But what
That's
kind of
my
look
opinion.
Given away by doing it.
We agree on 32.
Yeah.
I see what you're saying, Dennis. Less people there, the less
I
you
thought
got.
that's what we agreed on.
We said
At one time, we did agree on 32.
No more.
No more than
Period.
30. But we're at
And after
31.
that, we voted on 32.
Yeah.
People should be told who are coming that it's not a long-term program, but if you've authorized 32, you ought to be able to take 32 because it's going to mitigate the loss.
That's the way
Well,
I understood it, that we would set the bar at 32, and that he was to maintain the 32 thing was 32.
I said we shouldn't take any more when we authorized the 32. I'm still saying I don't think we should be taking any more.
That wasn't the vote.
I understand.
He was for 32. Okay. You're next, I guess.
Well, you're both,
Approved contracts for kid services, outpatient diagnostics,
Yeah.
fees for services.
I think everybody remembers, we had quite the discussion a month or so ago. We left what I called 4 and 5 out there. We have 2 choices. I'm going to take the diagnostics first. Last 3 years, we've averaged 5.8 diagnostics. I think it's 4, 5, and 7, something like that, guys. 4, 6, and 7. So it's about 5, 6, 5, whatever the hell it is. We've averaged the House of Good Shepherd, an average about $750, and $1,750 for Kids Herkimer. We'll do this year, probably, even though we've been averaging about 6 kids, my guess is we're gonna do probably closer to 15 or 16 this year. And again, we all understand, by doing these, it's saving us a lot more than doing an inpatient diagnostic. So the choice that we have are the Kids Herkimer at $17.50 a diagnostic, or House of Good Shepherd at $7.50. Tim talked with Denise today and verified that, you know, if they only got a piece of the puzzle,
Who's Denise?
Kavanaugh with, I'm sorry, Helen, thank you, with House of Good Shepherd, she verified that they would do a piece, you know, that they didn't have to have the whole grant to keep that same price and to do that. So the choice is between Kids Herkimer and House of Good Shepherd. House of Good Shepherd's $1,000 cheaper on the average. Per kid, that's what, absolutely, Kurt.
Why the increase, do you expect the increase to go to 15 or 16?
We've seen a tremendous increase, Helen, to date, in the first 3-4 months. I'm sorry, the first 3.5 months. So we're
What do you
extrapolating.
think causes it, Tim? Do we have the court, is it?
I have no comment.
All right, Mr. Cam, no comment. You don't know what's causing it?
Mr. Chairman, Tim is, I know we went with your comfort zone of your staff for the last one, if I recollect on that. Now, you're comfortable with this situation? Your staffing is comfortable with this?
Which situation?
With the diagnostic, going with,
I've spoken with my staff on that, yes.
they're comfortable with that?
They're not as comfortable as they would be, but yes, they'll.
Who are they recommending?
Okay, who are they recommended is my question.
They recommended Kids Herkimer, but obviously there's
For the $1,000 form, right?
But, you know, we've worked very hard the last 2 days, myself and Tim and his staff. With our contract we do, I think this was a great process, a great learning process for us. I think we all know that Gina received a grant, one of 4 across the state, to do monitoring. We need to do better monitoring in DSS. We'll do all the kids' programs that we have, and if the House of Good Shepherd gets this, we'll monitor that also.
Well, that's why I was asking if their comfort zone, Mr. Chairman. That's
Well,
all.
my only question is, Kids Herkimer and House Good Shepherd bid the last one, and House Good Shepherd was about 30,000 less, and we still didn't go with them. What your comfort zone wasn't with them on that line item. Why would we go with them on this one?
this is.
I'm just asking. I mean, I asked you that question before, but I didn't get an answer, so I'm asking tonight.
You're asking why we would settle for the House of Good Shepherd?
Well, no,
Diagnostics, that's my answer, is we would.
No, but the last line item that we did vote on before, our House of Good Shepherd was 30,000 less than Kids Herkimer, but we didn't want to entertain them at all, and I was just wondering why we're okay to go with it now.
I think that was a different service, correct?
What, yeah, it's just all in the same family, is what I'm saying.
Well, it's not the same family, the diagnostics is an evaluation. Again,
Right, but I asked,
I'm deferring to my staff's recommendation.
okay, I just was curious why, you didn't seem to be comfortable with them last time I asked the question, so I
And
just
the
was.
staff was not,
Huh?
and the staff was not.
Okay.
And the staff is comfortable with this one.
Bill?
They'll get comfortable.
They will get comfortable. They're not gonna,
Our recommendation is to go with Kids Herkimer.
Well, House of Good Shepherd is an accredited organization,
Absolutely.
there's licensed people. and
My
it's
brother
the
works
case-
for him, just so everybody knows.
You what?
My brother works for him.
I want to go back, Mr. Chairman, if I might, why the increase, though? I know Mr. Wallace doesn't want to comment on it, but I do think that we need to understand what is happening that's causing, if we have an average of 5.8 and we think we're going to go in at 15 or 16, I mean, that's 3 times.
I just think it's responsible for me, Helen, to say that.
I appreciate it. Can someone else voice an opinion? Can social service tell us why we're forecasting?
They don't
such a-
know.
We don't have any guess on the kind of cases how it's different.
Guess doesn't help me.
A review of the kind of cases so 15 or 16 is based on what then?
The first 3.5 months, as I mentioned.
So it's a trend.
Absolutely.
And any new players into this would be family court.
Correct.
All right. So we need to understand that it's a court issue that's bringing, and whether it's good or bad, I don't pass judgment on that. We just need to know that there's been a change in the court. And, okay.
Dan, why would why would you prefer Kids Herkimer at $1,000 more per kid? I want to make sure that I'm stating things correct.
Sure. The only reason, I think, is that we've had a contract with them since 2009, doing the exact same procedure. So we have a system in place already, okay? My staff has worked closely with them already. We don't have any in-house House of Good Shepherd staff in this capacity. Albeit we do business with them, of course. So I think that's it's a relationship that's been built. That's the main reason.
If shortcomings develop, how quick can we get out of this contract with House of Good Shepherd?
I would say 60 days then.
So, I mean, if you find out it
Usually
doesn't
take 30
work,
days, but I think it would take 60
and
days.
document the shortcomings and come back to the committee, we can get out of this contract and
I think that's
go
what we were
someplace
alluding
else.
to, then, that we would monitor it very closely and keep the committee, both committees appraised.
I would expect them to.
Are there measures, concrete measures that you can evaluate them against?
Yes.
Okay. And
I believe
that's
so
pretty
also.
cut and dry.
Mr. Chairman, Tim, how many are you saying they're gonna do?
Who's going?
Kids Herkimer. Is it just $1,000? The same amount of people?
It's not, the way Kids Herkimer has it, it's X dollars per diagnostic. The judge could order 100 of them.
Right.
It's per kid.
I can't control that.
Will we
Okay.
get monthly reports on how it's going so we can see trends? Is there
If we
something you can
get
do
a
for us
family
as
court
we're
judge that
watching
wants
this?
to.
If it's tripled, Jen?
But we're not
We'll
gonna
have
have control of that. We'll have control of that. That's the
I need a motion in Ways and Means Committee in regards to,
So moved.
For
so
what?
move for which one?
Ways and Means.
For what?
But I mean, House of Good Shepherd at $750.
And proposed, yes.
Okay. Is there a second on that?
I'll second it.
Okay.
And Mr. Chairman,
I need
just
the
wanna-
same motion in human resources.
Fred and
Mr.
Mike?
Hendricks, seconded by Mr. Hyde.
Me.
No, not you.
Fred.
Okay.
Thank you for trying.
Given the comments that have been made though in terms of our comfort level, I think we can take that and we can take it out to many other things that we might be bidding or deciding to go because of comfort levels. And I think we should always police ourselves to recognize when we're dealing with people with good credentials in the community, if it's this, if it's engineering or whatever it might be, that we be vigilant to the fact that there's quite a bit of difference here in the price, and we should be paying attention to that, and not weigh so heavy on comfort.
The only problem with this is it's kids' lives you're dealing with.
I understand, but they're accredited
And you can't go
organizations.
back and fix
No.
those mistakes after they've been made.
But we're not talking about
If
going
a
out and
kid
picking
isn't-
somebody up in a subway
If he
station.
isn't diagnosed right the first time,
Yeah.
you just can't go back and say, oh, we made a mistake.
Oh, absolutely.
But Doc-
We want to deal only with reputable companies.
If we're dealing with two companies, we're documenting what we're doing with them, then we can bring it to the table. It's not just, my staff are comfortable here, they're not here. I think that was my argument before. We need to do a better job documenting, because when we're getting rid of a company that we're dealing with over another company, and we're spending $94,000 more to do it, we should have some documentation to support it. That was my argument before, it's my argument with this one. You should have documentation, you shouldn't just go, well, because Johnny and Sue want to do
Ways and
it.
Means, all in favor, please.
All right.
Anybody opposed? Carried, Ways and Means.
Human resources,
Aye.
opposed.
Fees for services? The spin services, basically, I think that we, again, a lot of confusion the other night. We basically use three spin services: Parent Aid, Rise and Shine, and Mentoring. The Parent Aid program, Kids Herkimer is $2 cheaper. Rise and Shine, there was not a proposal from House of Good Shepherd. And Mentors, which is the biggest, that's the biggest service we use, guys. The other ones are very minor, not minor, 164 hours and 22 hours. 577 hours of Mentors, House of Good Shepherd, $28, and $40 for the Kids Herkimer. At total, you know, if it stayed that same number of 577 hours for this year, and again, that's all we have to go with, guys. We can't come up with anything else as far as what we're seeing so far. That would be about a $6,900 difference to go with Kids Herkimer. We'd like to see us go with Kids Herkimer. I think when you start parching some of this stuff, I think a little bit of Kurt's answer by Tim, start doing that with some services here and other services there, it could cause a problem for us. But again, we respect your decision and we'll follow your decision.
So what you're saying is this all, the parent aid, the Rise and Shine, and mentoring is all one bid?
Doesn't have to be.
That's
That's why I parsed them between the three different ones.
So Rise and Shine, who bid on that? Just kids or?
Just kids. And the parents, they were $2 cheaper, $35 to $37.
Are each of these mandatory, or they're just the full piece that we put together?
No, these are the
They're
pieces, Helen, we're
comprehensive
trying to put together to keep the kids out of care.
Right. That's comprehensive.
So Tim,
Yes.
just tell us about the mentoring program and why you think Kids Herkimer would be best qualified for that.
First of all, in the proposals, the mentoring is a specific offering of Kids Herkimer. It's in the proposal from House of Good Shepherd, it was a small piece of another. Actually, it's what they entitled it is skill building, and it was a very small piece. Our people use the mentoring. I wish I could have the numbers for you.
It's 577 hours, then?
577 hours, which is fantastic assistance, and it combines with the parent aid. It's all tied together with the process that kids uses on their reunification program. And also, if I could interject here, I don't know what the view of the legislature is on this, but these are just 3 services that are under this fee-for-service program that Kids Herkimer offers. And so we picked out the ones that we use the most. So I don't know if when we do accept or not accept this, we probably should accept it as a whole package, because there's over 50 services that they can provide us. And we never know which child is going to need a specific service.
Meaning Kids Herkimer has 50 packages.
Yeah, 50 services under that package, whereas the other one, I think, has 6.
Did you ask if they have more? In their proposal, they showed 6, but do they offer more? Did you ever get back to them and say, do you have more than just 6?
No.
See, that's the problem I had.
I don't know what else I could put in there.
But you can call and ask them if they
And
have.
we have to come here to the chairman, so we've got a huge agenda here. We need to be able to control this instead of just people jumping in. How is this being paid for? Is this county money or is this?
This currently, and we do have a current contract that has these services on it, is being funded by FFS Flex Fund 100% federal.
This is 100% federal?
That's correct. This particular component, as it's
It's
contracted.
been service component.
Well, it's part of a kid's
Or the
contract.
mentoring
they have.
program.
That's a federal funded program?
This contract, as it is written since 2009, is paid for by FFS funds.
Mr. Chairman, is that all 3 of them? Well, is it all 3 of them? Everything's federally
When you say
funded
all
on it?
3, which ones are you referring to?
The whole group that you were just saying?
Rise and Shine,
Rise and
parenting and
Shine.
mentoring.
Yeah,
That's all
yes,
100%
part of-
federally funded?
Yes. That's how
So-
we're paying for it, yes.
So, as we said, the other one, if it's federally funded, who cares if we spend the extra money, right?
Which other one are you talking about?
Kids Herkimer. Or Kids Herkimer against the other one that you guys said they put the bid in on.
On the last?
House Good Shepherd.
Or no, who's the last?
This is being paid for by federal funds.
Federal funds,
That's what he's
okay.
trying to tell you.
That is what I'm saying.
Mr. Chairman, yeah, I'll make the motion that we take recommendation and go forward.
Is that a motion? Wow, you're right next to me and I can't hear you. So we have a motion in both committees to accept the bid of Kids Herkimer.
Mr. Chairman, can we have it defined?
Is there a second on Ways and Means?
I'll second.
Okay.
Second on human resources, Mr. Hendricks.
And all 3, can we just give, I agree, I think I know where Helen's going to break. Just what the difference in numbers were again,
Just what
quick,
money is.
just a quick difference in money.
$2 cheaper on the parent aid.
Based on how many things will you be doing? Was it really material? $2 cheaper by how many units?
500.
I think what I mentioned, Helen, was 22 units at $2.
22 units a month?
No, for the year.
Oh, okay, at $2?
$2 difference, or $2 difference.
Yeah.
I just want to make sure we're on.
Okay.
Rise and shine, no comparison.
If they don't do it.
And then 577 hours was the mentoring, and that was $40 for kids and $28 for House of Good Shepherd.
So it's
Is that what we were looking for? I got other numbers too. So.
Oh, no, which is the one you said no comparison, Rise and Shine?
Rise and shine.
Because we don't know the cap, that,
Yeah, it wasn't included in their RFP. Doesn't mean they don't do it, but they didn't put it down.
Is there any other discussion? We have a motion to accept Kids Herkimer for these 3 services. All in favor? Opposed? Carried.
All in favor for human resources?
Aye.
Opposed? Carried.
Amend budget for additional funding for rabies grant.
Thanks, Tim.
Amend budget for additional funding for rabies grant.
The rabies grant, each year we have a grant that is about $6,000 or $7,000, and based on our actual expenditures, if the state has money, they give us an additional amount of money, which they've done this year for the period ending March 31st, and it amounts to about $7,000, and that is based on the extra money that we spend beyond what our grant is.
Okay, can I have a motion to accept
So
that?
move.
I have a motion to accept it.
Is there a second on Ways and Means?
Second.
And Kurt.
Second, Hendricks.
All in favor?
Aye.
Opposed? Carried.
All in favor of human resources? Opposed? Carried.
Approve contract and budget amendment for early intervention program.
It's basically a renewal, no changes.
There's no budget amendment.
It's $40,428.
What is it?
$40,428.
No, sorry.
Okay, just approve contract then for EIP. Motion, please, Ways and Means.
Motion.
Is there a second?
Second.
can we know who the contract's with?
The contract is between New York State and Herkimer County.
I have a motion for Hendricks and Mr. Shaw.
Is there any further discussion? All in favor?
Aye.
Opposed? Carried.
All in favor of human resources?
Aye.
Opposed? Carried.
Number 6 is accept health net funding and amend budget. Is there amendment on this budget, Bernie?
The health net, yes.
Okay,
$175,000?
Yep.
so that's additional money we received?
Yes.
Yeah.
Okay.
It's for April 1, 2012 through March 31st,
Is there a
2013.
motion on this, Ways and Means? Second? Bruce?
May I have a motion for human resources?
Motion.
Gene? Fred?
Any discussion? Both committees. All in favor, Ways and Means?
Aye.
Opposed? Carried.
All in favor of human resources?
Aye.
Amend budget immunization action plan.
This is just another renewal of the grant with no change.
So there's no amending of the budget?
Yes, this does have a budget amendment. Usually we budget it in the budget, but this year we didn't, so it's $31,865.
Ways and Means, motion.
So move.
Second?
I'll second it. Human resources? Motion?
Aye.
You made the motion?
I made the motion.
You gotta vote.
I've got something for,
All in favor, Ways and Means?
Aye.
Aye.
Opposed? Carried.
All in favor of human resources?
Aye.
Opposed? Carried. Is there any other for human resources?
I got something for.
Okay,
I wonder, since Dr. O'Keefe is here, Mr. Chairman, the prenatal care program that we have, I would like to know the status of it. I know we talked at budget time, and that particular program. And I've been told that we've lost our provider come June, and I want to know that is there something happening on the prenatal care program? And just where do we stack up on our, healthy mother, healthy babies? And I don't know if that's something that we're ranked against other counties or what the status is.
That was just phenomenal. Thanks for the softball on that one, Ellen.
Say again?
Thanks for the softball on that one. We just got a report that Sandy and Doc shared with me. I'll send it to all the legislators. We were in the top percentile across the board, 12 for 12. We did a wonderful job. I'll send that report to everybody.
On healthy moms and healthy babies.
Absolutely.
Are
Which is
our
fantastic.
program,
And Doc, thank you and Sandy for that.
the provider that we have, are we losing a provider for that program?
Yes, Doc has been talking with us, and we're having some preliminary discussions. I don't know if Doc.
I just think the committee ought to know if there's
No,
going to be change in that program.
there's some concerns, absolutely.
We're working hard on that. It's a delicate issue, it's an important issue, and our provider has been running a family practice residency program using us as the site. And the nature of their program is that they're pulling back into Oneida County. And as of June 30th, they no longer provide those services at our site. They've indicated that they would continue to provide services with our patients at their site in Oneida County. The other aspects that we've looked at are hiring a physician to be our physician. This is a difficult thing since all the physicians who've done obstetrics have left the county, and no one seems to want to take on that. The price is overwhelming, over $300,000 for an obstetrician, and then the other aspects are how could we streamline, how could we help our patients get started under treatment earlier, and that's where we are right now. We have discussions going on with the 4 different hospitals about what role they might play.
Okay, so you'll have a report for the committee next.
Well, hopefully by the middle of May.
But, so our loss of a provider is not something that they're dissatisfied with us, they just have a professional reason that they're pulling back, there's no dissatisfaction with Herkimer County?
No.
All right, thank you.
Anything more for human resources?
One quick question.
Yes.
Is this prenatal care, is that a mandated public health service?
This is not a mandating
It
program.
is not one of the mandated, thank you.
Anyone else? Can I have a motion to adjourn the Human Resource Committee?
So moved.
All those in favor? Aye. Opposed? Carried.
Do we have a Ways and Means consent agenda, number 9 through 14?
I'll make a motion on all of them.
Is there a second to that?
I'll second.
Is there any discussion on any of those? We okay? All in favor?
Aye.
Opposed?
Lennon Bernie?
Carried.
Bruce and Bernie? Bruce and Bernie, right? Bless you.
Thank you.
Hold it down over there.
Good luck.
I'm gonna go to number 17. Approve increase in district attorney's salary, which we have no choice, and Jim can talk to us about
I've
that.
got your oath of office card here, guys. We were all approved to follow the state constitution. I think everybody knows that the district attorney's salary is being raised from 119 to 140. State law, not state mandate, state law. We need to approve it. We need to put it in the salary schedule.
Who do we pay? We don't have a district attorney, do we?
Okay,
The acting is Jeff Carpenter.
So
And there is
we
money,
pay the acting
there will be
people?
money, I'm sorry, Mr. Rowe, there will be money in the budget because he's only hired 1 assistant.
But the issue is here, we have to do it,
Change the
and
salary schedule.
we have no choice in the matter. And is that all county money, or is?
40% for this year will be state money. I think everybody remembers the last time that was here, they gave us the money for the first couple of years and then took that away from us the last time they increased it from 79 to 119.
So we need a motion.
I'll move.
Second? I'll second it. Okay.
Yeah, Jim, would you,
Hang on a second.
yeah,
I'm sorry, guys.
What, Joe?
Carol and Sally are safe. Who made the motion?
I second it.
Any
The
discussion?
only discussion is, for, when this resolution goes before the full legislature, how many years was the DA salary 119?
I'll have that for you.
By the resolution time?
It's the last time the judges got a raise, probably, what's that, 10, 12 years?
Is it 10 or 12 years that it's been 119?
Steve, 12, yeah. it's-
So, I mean, that does,
Yeah, you'd
It
rather
spends a
see
lot
them
of-
give a 1 or 2%
yeah,
increase a year,
yeah.
so we don't get into these lump sum, but they do it every time.
I've also asked Jim to give us a little purview of how the state budget might affect us in terms
Absolutely.
of next year.
And I think everybody can tell that's very worrying to me.
And so that'll be done at our next legislative meeting. Mr. Chairman, I'm gonna ask for 5 minutes for Mr. Wow.
Only 5 minutes of pain, Jim? How long did you go?
That's all I can take.
18, approve stipulation of settlement.
I'd like to go into executive session.
Is that an executive session?
I really believe that.
Oh, yes.
How about the next one?
19?
Yeah.
Jim, is that executive session?
119.
Number 19?
No, that's just our mortgage tax.
So moved.
Is there a second on the
Thank you.
mortgage?
I second it.
Okay, all in
Dennis
favor?
and Bruce?
Yeah, that sounds good.
Dennis?
Okay.
All in
Again, I
favor?
don't like it because we have to keep begging them every so often, but we need the money to keep it off the property tax bill.
Okay, number 16 may be a executive session, that's why I held that back.
If it's not about a particular individual, does it have to be?
It is about,
If
Or
it's
is
two-
it about a particular individual or
Two
a
specific
position?
individuals.
yes, it is.
It's based on the employees, it's not based on the position?
No, it's two positions,
Positions are not executive, though, are they? If you're talking about the individual employee, but if it's just a general position, is that executive?
I believe you're talking about the two specific individuals.
Yeah, that's what I think too. You're correcting what you're
Absolutely.
saying.
No, I
Todd
don't
Freeman's
disagree.
gonna be at SUNY IT tomorrow night.
I think though we'll be getting into
I'm at the
discussion in
United
regards to the individual.
Okay.
That's why I want executive.
I'll make a motion to go into
Well, how
executive.
about 20?
Wow, hang on a
Can you vote
second.
on,
Records management position.
what?
Now, this was just a,
The home rule request?
Yeah. We did the home rule request, didn't we?
vote
on
Yes.
You voted on home rule.
Home run?
Number 20, approve backfill of records management. I'm just trying to get those things that aren't executive committee.
this was just done in open session, so if we can do it in open session.
And this is,
Sylvia looking to use one of our very good employees, who's part-time, with DSS, and give her additional hours within the Records Management County Clerk's office.
did you know that we've tried to avoid doing these, especially as of late, because of the fact that it's going to put this person into a benefits position?
Either of them test for civil service tested, either of these positions?
Both part-time, correct?
No? If we make a full-time position, would one way or another, would she come under some kind of a testing guideline? If she's a full-time individual?
No, because both of, it's two non-competitive part-time positions. It makes it a full-time position in terms of benefits,
Mhm.
union contract, but no, it's two
Still-
part-time, non-competitive
It
places.
still keeps her out of a testing category.
It's a unique situation. I agree.
Mhm. You'd be better off with two people working part-time,
Yeah.
That's correct.
as far as the money's concerned.
So if that's the feeling of the committee, what would we do here? Just make a motion to deny or not do anything?
Let it die. You can do whatever you want, but if there's not a motion, do it instead.
Okay. Is there any motion? We need a motion to go into executive session.
So move.
Is there a second, Kurt? Okay, we are in executive session.
You're good. We gotta take a look. No, we gotta take a look. We gotta take a look. So-
Okay.
The actual Half the actuarial, they still-
Honor the 75%.
Dennis,
ahead.
Dennis has the floor. Dennis, go ahead and repeat what you said, so.
When a township or a village that's in our old workers' comp plan gets out, it triggers an actuarial study. The last one was $13,000. And our rules, this committee determines the rules of the workers' comp plan. I'd like to see if those rules could be changed so that any municipality that wants an exit either pays half of the cost of the actuarial study, or all the cost, or a portion of the cost, some portion, if our rules allow us to do that. I just want it researched if we can do that.
I mentioned it to Rob. He thought so, but he was gonna look into it.
Or if the actuarial study done in the past 3 or 5 years would suffice, so we could go back to one that's already paid for. One or the other. Some way that we can avoid the cost for the plan.
So you're saying if the person getting out wanted a different actuarial study, that they would have to pay for it?
If they'd accept one that's on the table,
We would want with health insurance, no way, guys, please don't do that. I'm not saying don't have people pay for it,
right.
but how in God's name with medical costs,
Oh.
can we take a year-old?
Or 2 or
I
3.
think we're being very
Yes.
foolish, guys, to say.
All right. Is there a medical multiplier we could apply to the actuarial study?
Absolutely, if you could look at something like that, I
You
can
know,
live with that.
I'm just saying,
I mean,
I don't want to just forget about it, and all of a sudden next year, we get some notices, and I know that the time is running short for us to amend it, because if some township is contemplating getting out, they're going to be sending us a letter.
Yeah, the only one I'm concerned about is Norway, because we asked Norway.
Newport,
I'm sorry, Newport.
yes,
Because we asked Newport to stay in, and they considered it and did,
I know.
even though they wanted to get out, so. That's my only concern at this point.
They stayed in to save us that money for the actuaries.
Yeah, and I
Thinking
appreciate,
Columbia was gonna do the same, but they didn't.
The other issue is, maybe you want to bring it up, but there's been discussion in regards to we buy out of does the
even the
county,
county, yes.
does the county buy out?
So moved,
I'd so move it, I would so move it. Because when it's all done,
what are we crazy?
if we come up with our money, even if it's an unobligated fund balance portion that we put up, it takes away from our annual bill, and if there's nothing left in the end, we're on the hook for it anyway.
Plus, doesn't it help
And-
in our-
And you're talking 25, 30 years from now. So it might be, for budgetary purposes, it could be a good way to go.
Something to look at.
And Dennis was
It's
still.
definitely worth something.
Great
He'll
idea.
still be here.
Now, the thing is, though,
Yeah. If you approve yourself.
I say make them split 50/50.
the,
I say make them split 50/50.
Well, the way it's set up, they have to submit letters.
with this does.
When's the letters gotta be in to get out for next
June
year?
30th? I'd say July 1st. July
July
1st to
1st.
get out for the following.
We have to receive a letter from a municipality wants to get out by July 1st. So if we're gonna change our rules,
So do it then.
but then how do you fare to Newport that we know stayed in because they thought Columbia was gonna, I don't know, it's a mess. Yeah, it's a tricky
Same
one.
thing with everything else, you do it for one, you
It's
gotta do it
You
for
can make a
everyone.
1-year exception for that.
Yeah.
So anyway, we're gonna be looking at that, we're not saying we're definitely
Yeah,
gonna do it.
please, I just wanna make sure we look and don't forget to look, that's all.
So we got between now and June 30th, and I guess Jim and Steve and,
I've had conversations with Rob, I'll get a definite.
I mean, if
I believe you
Herkimer,
have to do a whole.
if Herkimer County bought out now, what would we say?
What was that, 3.75?
Yeah, I guess.
that's about right.
3.5,
That's 75,
3.6,
if you guys
3.7,
give yourself a 75% buyout.
Right. We're a member of the plan, if we gave ourselves a 75%, a 25% discount,
Everybody else.
that's the amount of money we'd have to put up. We could put up unobligated fund balance.
And I believe that also helps free up
I
some
want
of
to tell you
our
something,
percent.
don't go from this room and tell anybody that you're thinking about doing it.
No, I understand.
Because
It's
if
on
you
camera.
do, yeah, every town in this county will buy out the next day.
Yeah.
And then
But then again, you also have that money.
you'll have that money, but
And you
you'll
might
have
be
that big
further ahead.
bill.
Yeah.
If that were the case, what Dennis just suggested, and what you fear, everyone bailed out, then should the fund come up short, it's distributed over the entire county, all townships.
It's the county's bill.
The county's bill.
That we end up taxing for,
Right.
Yeah.
borne by all.
Yeah, it'll be borne by all.
Is that fair?
No, yeah,
I don't know what's fair.
I don't know.
Why is it fair?
I live in a world that's not fair in here.
Why is it fair for?
We're the sponsor of the program. So if in the end, and the program's done and gone, if there's money due and owing, we make it up.
What if the program comes back?
By taxing everyone?
Really? Stranger things have happened.
Within your 2%.
Yeah.
History repeats itself.
Anyway, it's worth looking at to inform ourselves, to educate ourselves.
That's a good point.
God.
Having anything else, Mr. Chairman?
Motion to adjourn.
Second.
I second.
All in favor? Opposed? Carried.